So what I want to talk about is, as you've probably seen from the title, user-centered design in healthcare, and how to create products that truly put the patient and the user at the center of everything. So that's me. I'm currently working as CTO at NUI. We are a startup based in Munich, and we are at the moment creating an app that's helping you when you take care of elderly relatives. And it's helping on the one side the caregivers. So it's about making their life easier and helping them to organize the care better, which then should also lead to a better quality of care for the care receiver. So for the seniors, the idea is that their care and with that their quality of life will improve with our solution. But as you can maybe see from the picture already, I'm using a wheelchair, and that's because I have a physical disability. And that means that when it comes to these digital solutions in healthcare, I'm both. I'm on the one side a user of these products, but on the other hand, I'm also a creator of these products. And so for me, like having great solutions and this outlook of having great and useful solutions and useful products in digital products in healthcare is amazing, because it could really also improve my personal situation, my life very much. And this is why, this following talk will be something that's actually very personal for me. And this whole topic is because of this, because of me having having both roles, not only as a creator of these products, but also as, a user of these products. This is why, this whole topic is something that's very, close to me, and something that's very close to my heart, and something that's very dear to me. So what do I have? I have something that's called spinal muscular atrophy, which is a neuromuscular disorder. So what does that mean? Well, if you think about, let's say you want to move your arm, then you are conceiving that movement in your brain. You're like, I want to lift my right arm. And then that information is transmitted to your muscles, and then your arm will move. But for me, that transmission is not working as expected. It's not completely broken, but this transmission is weakened. So I don't, my strengths, but also my, agility, dexterity, my endurance is limited because of that disability. And so this is why accessibility, when it comes to digital products, is for me super important. It's something that I personally need very much. And a couple of days ago, I found this, this picture here on LinkedIn. And it's something that I could immediately very much relate to. This, don't confuse the 1-hour lecture that you had in your studies with me, like I've been living with that for, in my case, not 20, but 40 years, So I'm an expert on my own disease, but I know for a fact that, like if you study medicine here in Munich, in Germany, you will have exactly 1 hour, one lecture about SMA, and that's it. And if I will then meet you maybe 20 years into your career, you might remember, yeah, okay, I think I've heard that term at some point, but you probably don't remember that much. And you probably, and that's something that I've experienced over and over again, that doctors, like even confuse what I have with something completely different, because they don't exactly remember what it was. And this is something, that's not happening to me. That's happening to a lot of people especially with rare diseases. And that, leads to a lot of friction and often to frustration. And it's not only, of course, the doctors, as a patient, you're living in this whole ecosystem of stakeholders. There are the doctors, but there's, of course, also health insurance. There's your family. You have to regularly, more often than not, go to hospitals. Maybe there are pharma companies who want to sell their stuff to you. And if you talk to them and if you interact with them, everybody seems to know what's best for you as a patient, right? everybody of them seems to know, yeah, so what he or she should do is really that, or what they should do is this and this and this, and then for sure their life will improve. And, I know everything, I'm a doctor, or I'm a pharma company, we've been dealing with people with SMA for the last, I don't know how many years, so I know everything about them. And at the end of the day, then you as a patient are at the end of all of this, right? And you have more often than not this feeling that everybody is dragging you and pushing you, and everybody seems to know what's best for you, and everybody seems to know, everything about you. And my strong belief is that, as well as a patient, as a creator of these products, or as a designer of these products, I think the only solution that you have is you have to put the patient at the center of everything, right? Of course, doctors and pharma companies and your family and so on, everybody is super important. Everybody plays a crucial role in the life of a patient. But at the end of the day, the only one who knows the whole truth about the patient, the only one who should be at the epicenter of you when you're creating a product for them is the patient. He should be not the end of everything, of all of these chains and all of these things going on, but the patient should always be at the start of everything. He should always be at the start of when you're thinking about, designing a feature, creating a product. The patient should always be, and he has to be, at the start of everything. But the truth is that in the past, most of the time, this was actually not the case. There is this great hashtag that you can find. It's like this, talk to me, not about me, Most of the times, everybody is talking about patients. He's talking about, like we know, and this should happen, and this should happen, and you should do this, and we will do that. But they are not really talking to the patient. It's always this or very often, and this is something that I personally experienced over and over again, that, they are talking about you, but they are not really talking to you, because talking to you is cumbersome. Talking to you can be a tough conversation. So they take the easy way and talk about you. But, where all of this might sound a bit depressing and, we know it's not everything is going great. I think that digitalization actually has this amazing potential to all give us a new chance to do better, right? Of course, in the past, there were mistakes in the healthcare system, and I think we all, and also the care system, I think we can all agree on that mistakes were made. But with digitalization and with the introduction of digitalization into that area, we now have this great opportunity to correct some of these mistakes. That doesn't mean that we can, start from a blank sheet and that, we can do whatever we want. We still have to, of course, live within that ecosystem that is existing and play within that system. But, we still have the chance to create something new and to correct mistakes that we've done in the past. And I think apart from the fact that, we now will have, hopefully, scalable solutions and easy-to-use solutions and accessible solutions and individualized and tailored solutions, I think there's one other fact that's often, in my opinion, goes a little bit, like unmentioned, something that's often a little bit overseen, and that is the fact that, with digitalization, there are also now, it's bringing in new people, like so far we had doctors, we had patients, we had insurance, but now we also have designers and creators and software developers. We have interaction designers, UX designers, service designers. We have now a whole new set of skills that's coming into healthcare and into care, and that's bringing a fresh and an outside perspective on things. And I think this is a great a great opportunity to do new things and to do better things that we've done in the past. And I mean, there are two, I would say, topics that I always, like two things that are for me very important. And the first one is, we now have this great opportunity to create accessible products that are very precisely tailored towards individual needs, right? Like we can now create products that are not, that are very specifically, for example, tailored towards a specific disability or towards a certain condition or towards, elderly people or something like that. And that really, have their individual needs and their individual problems in focus. And that allows us to, to solve a lot of things that are maybe not going so well at the moment. And there are like maybe a couple of things that I would like to mention out of my personal experience and out of me personally working on projects like this for the last couple of years, and maybe some, I don't know, whatever you want to call it, maybe tips and tricks or tips and hints. So like the first thing that I always like to do, or the first thing that I always think is super important when you are creating a digital product in healthcare or in care, is set up a patient panel. Like try to find a group of people, of your target audience, of the ones that your solution is meant for, and like say 10 or 15 or maybe 20 people, and closely work together with them, like set up this panel of patients that you have easy access to, that you can work together with, that you can have a co-creation process with, where you can get easy and quick feedback at any time, and don't see them as, a couple of people that you can use for testing and where you maybe, like every once in a while you do a presentation or something like that for them, but see them as partners with whom together you are developing your product. Like if you have this panel of, let's say, maybe it's even 10, 10 patients, 10 users of your product that you are closely working together with, they can give you so much valuable insight, so much information that you can't get otherwise. Like for me, on the projects that I've been working on, having this patient panel has been something that has super helpful and a very important factor in the success of these projects. The other thing is, I think that technology now allows us to get much better in touch with our users. There are no longer, you had these excuses in the past, right? Like, let's say you're working on something for a rare disease. Okay, let's take SMA, spinal muscular atrophy, as an example. There are, let's say, around 2,000 people with SMA in Germany, and worldwide there are maybe a couple of 10,000 people, and they are of course scattered all over Germany, right? So getting in touch with them in the past was complicated, and like it was, you had to travel maybe, and then and for these people to travel was maybe, or in general, I mean, that's not only true for SMA, but also for a lot of other disabilities or conditions. Maybe traveling for them is exhausting or not that easy to do, or maybe, like they spend a large part of their day in bed because for them that's the most convenient thing to do. And getting in touch with them in the past was complicated, but now, that's no longer the case. We did just Zoom calls and Miro boards, or there are so many tools out there that you can use to get in touch with these people, and that you can use to get easily in touch with your users, and where you can get this feedback, and that allows you to really create products that are tailored for them. Like you don't have no longer, you now have the ability to really talk to them, not about them. You can talk to them. You can just set up a Zoom call and you can talk to them. And the truth is, they are more than, like at least in my experience, they are more than happy to talk to you, because they also want your solutions. Like, your solution won't help them, I don't know, to buy a new smartphone or something like that. Their solution will help them to improve their life. Like it's something that's, it's talking to them and getting that feedback from them can be so helpful for you to create that solution. And I mean, the other thing that, having these conversations can sometimes be tough. These can be, serious and tough and sometimes even depressing conversations, right? When we did user interviews in the past, we sometimes, we were talking to people about, death and death of children, or unemployment or loneliness, severe topics. So these conversations were not easy for us to do, but we got so much feedback, and we got so much important feedback, and like it's also so motivating to see that you can do something to really help them. I think it's super valuable, like do it and have these conversations, even if they can be, if they can be tough. And yeah, it's sometimes maybe tempting to, take the shortcut and have the easy conversations with the doctors or with insurance or, maybe even with the families. These conversations are often easier because you don't it's like a filter. You don't have the direct contact. These conversations can seem to be easier, but the truth is the only place where you will find out about the real truth of the patient, about his reality, is by talking to him. And that's why you should really do it. And that's why it's so super important. And then, of course, and that's one of the reasons that why digital products are often so, interesting is, we finally have the ability to make accessible products. But, making these accessible products on the one hand is, like a great opportunity, but at the same time, if you don't do it right, if you don't do it correct, you will just achieve the opposite. So instead of, making something better, if you make your digital solution not accessible, you're making something that's maybe even worse. And if you think about it, like you have all these things when it comes to accessibility, right? Like color blindness and simple language, easy to understand language, and so on and so forth. But there's always the subset of things that are crucial for your users, right? There is a subset of things that your users really need. So for example, when it comes to SMA, like when you put complex interactions into your app, like complex zoom gestures or pin gestures and so on and so forth, then, well, you're making an app that's not usable for people with SMA. So basically, at the end of the day, you created something, that's not usable for your target audience. So figuring out what accessibility needs your users really have is something that's super important. And it's something that's, like if you don't do that, then technology, instead of, becoming an enabler, just becomes another blocker to inclusion. And then I think this is one thing that's also super important to me personally is, with digital solutions, we can bring that human touch back into healthcare and into care. I wrote this article a while ago where I said that I'm hoping that the future of healthcare is actually more analog again. Because if you think about it, how often have you been at a doctor and your doctor has, instead of talking to you, he has been talking most of the time to his computer. But with digitalization, we can create solutions that take these cumbersome and these complicated tasks like documentation and billing and so on away from the doctors, so that the doctors are finally, or that these, in general, healthcare professionals have finally more time to actually talk to you and spend time with you, and don't waste their time on these tasks that basically create no real benefit for their patients. And the other thing that I think is, with digitalization, we can create these platforms, like so far, and this is something that I've heard more often than not when talking to doctors, is, we can only be reactive, especially when it comes to, these rare diseases, and they see their patients only every couple of months or every couple of weeks. They can only react to what has happened so far. But if we create these digital platforms, we can, create a much better care. We can create something that's really tailored towards what they have. Like, of course, data collection in healthcare is a very, very sensitive topic and something where we have to be very careful. But by creating these platforms, like doctors can finally actively see, and this is something that they want. This is something that I've heard over and over again, that they want a platform where they can constantly have this feedback loop with their patients, where they can see, this is what has happened maybe in the last week, and maybe actually the patient doesn't even notice that something is wrong, but they see it and they can proactively, intervene. I guess at the end of the day, this is something that for me is the important thing, and that is, You know, like there's this great book, Ruined by Design, by Mike Montero, and he always says designers and creators of digital products have to be the gatekeepers. You know, like, and I think this is something that's, you know, super important. There are people in healthcare, and there have been mistakes made in the past, and there are people who see healthcare as a way to make money and people who are greedy. But at the same time, there are so many amazing people in healthcare, you know, like look at Corona at the moment and the doctors and the nurses who spend countless hours treating patients with Corona. And I think for us as designers and creators of digital products in healthcare, we have to be these gatekeepers. We have to watch out for these people and for the patients and for the people who are doing good in healthcare. And we have to enable them and we have to help them. And we have to make sure that the mistakes of the past, that we don't repeat them, that we learn from them. And instead, in the future, we do good. Yeah, and this is why I think it's so super important, the role that we now have, that we are these, you know, these gatekeepers who create, hopefully, a better future with digital products in healthcare. Yeah, and that's what I wanted to talk about. I think we now have a couple of minutes left for questions or topics or whatever you maybe want to talk about. Then I will also, I think, join this Q&A session. So yeah, if there's anything that you want to ask me or anything you want to talk about, just maybe put it in the chat. And otherwise, I will see you in the Q&A session. Okay, then I think I will. Yeah, thanks for joining. Thanks for listening to my talk. I hope it was at least a little bit inspiring and maybe you got something out of it. And yeah, if you want to connect with me, just ping me on LinkedIn if you have any questions. Cool. Oh yeah, thanks. Bye.